I'm Dr. Patrick O'Shaughnessy. Thank you for joining us for today's episode of CHS Presents Health Connect. Catholic Health Services of Long Island is an integrated healthcare delivery system with some of the region's finest health and human services agencies. CHS includes 6 hospitals, 3 skilled nursing facilities, a regional home nursing service, hospice, and a multi-service community-based agency for persons with special needs. Under the sponsorship of the Diocese of Rockville Centre, CHS serves hundreds of thousands of Long Islanders each year, providing care that extends from the beginning of life to helping people live their final years in comfort, grace, and dignity. CHS has a commitment to quality, and through this show and many community health initiatives, we aim to promote good health and provide you access to the care that you may need. I'd also like to thank and recognize each of CHS's 22,000 employees and affiliated medical staff members for their ongoing commitment to quality and service excellence, which is evident at each and every patient encounter. You all are the face of CHS, and we thank you for all you do for our patients and residents every day. On today's show, how you can get answers to your medical questions from the comfort of your own home, free of charge, and convenient to use. Through MyChart, Catholic Health Services patients can access their electronic medical records, send messages to your doctors and nurses, and request prescription renewals, and view your past and upcoming appointments. I have to tell you, I think this really has revolutionized the way in which patients can engage in their care and become activated. This online connection to better health can help you make important decisions regarding your care and provides faster, safer communication. On today's show, we'll take a look at the benefits of signing up for and using MyChart with Debbie Kelly-Scott, the Assistant Vice President of Ambulatory and Ancillary Systems for Catholic Health Services, and Jason Tagliarino, the Director of Population Health Systems for Catholic Health Services, as well as Dr. Michael Moskowitz, a primary care physician affiliated with Mercy Medical Center, and also visit Dr. Kenneth Fishberger's office in Port Jefferson to hear about how both a patient and the doctor rely on the program. We have all that coming up right away, so please stay tuned for our discussion about MyChart on today's episode of CHS Presents Health Connect.
Once there was a boy who did the same thing again and again. One day, he was told he had autism. He got help and slowly learned how to live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
Hi, and welcome back to CHS Presents Health Connect. Your health is important to you around the clock, not just during office hours. That's why Catholic Health Services offers MyChart, your connection to your doctor's office at any time. Joining me today to tell us more about MyChart is Debbie Kelly-Scott, Assistant Vice President of Ambulatory and Ancillary Systems at Catholic Health Services. Welcome.
Hello, Dr. O'Shaughnessy.
Well, it's great having you here, Debbie. Can you describe for our viewers at home basically what MyChart is? I mean, I know it means it is MyChart, but what's the program? How does it work?
Sure. Traditionally, patients have not had access to their medical records. And as we've converted over to electronic systems and our electronic medical records become available to our providers across the network, EPIC, the system we use at Catholic Health Services, allows a tool for patients to actually access their medical record, which is MyChart. So MyChart is a vehicle for a patient to access the medical record from the convenience of their home on a PC, from a mobile app, on a phone, or a tablet.
So it could be right on their iPad or iPhone or Android or whatever it is.
Mm-hmm.
Wow.
Very convenient application. So within the application, it allows the patients to see such things as medical history, medical conditions, medications, allergy lists, and they also have the ability to view radiology and laboratory results.
So all of that information could be accessed by the patient. How does the patient sign up for MyChart? How do they know that they can even get access to this great tool?
So we have many ways to have patients sign up for MyChart. So when a patient schedules an appointment at one of our CHS provider practices, they're given an appointment reminder with an activation code associated with that reminder. They can go online and activate the account and start using MyChart immediately. They can come into the practice, be activated by medical staff within the practice. They can visit one of our hospitals and have the MyChart account activated there. Or upon leaving any of our facilities, they get an after-visit summary or a discharge summary also with an activation code on it, which again, they can activate from home.
So all of these opportunities for them to really engage and, as you'd like to say, activate. We like an activated patient because they're engaged in their care and they know what's going on. How has this helped providers? I mean, you've been so integral in helping lead this initiative and have had this activated for so many patients and in our practices. What have you seen and what's the advantage that you've come to know?
I think the convenience for the provider is staying in their workspace.
Right.
As they convert to electronic medical records, we know their day becomes more complicated. They have more work to do when creating the patient record. But within that record, they see the messages from the patients. They see the results come in, and they're actually able to respond directly from there and get the communication back from the patient.
So there's the opportunity to directly connect electronically?
Directly connect without having to go back to their desk, look at the list of phone calls and messages that they have to follow up on, leave messages on answering machines, wait for patients to call them back. It's a simple message that they can answer at their convenience and the patient can pick up at their convenience.
And is MyChart available in languages other than English?
Yes, it is. We publish it in English and Spanish.
Wonderful. You know, as we talk about population health all the time and how important it is to have people be engaged in their health care, what do you think the future is for a program like MyChart? And I often laugh because I see my 9-year-old who has more apps and knows what to do on the phone than anybody else. But, you know, interestingly enough, my mom, who's, and I won't say her age because she will call me immediately and say, why did you say my age on television, Patrick? But my mom and dad are just as able to use, and they're enrolled in the program, and they use it just as well as potentially my 9-year-old could. Where do you see the future going with this?
So we work very closely with Epic, always looking at the new features that are coming out. So right now what we're really looking to roll out are video visits. And this is a feature that will allow patients to have a face-to-face visit with their provider from the comfort of their own home.
Wow, so basically like a telemedicine visit. So in other words, they might just be able to go online, push a button, have a video conferencing call. Say if I was the doctor, we would be able to connect via phone. I might be able to actually do what we would call a telemedicine visit, or at least give you some immediate advice on whether or not I think you need to go to an emergency room, an urgent care center, or come see me in the office.
Absolutely.
Wow, that's impressive.
And we're also looking at things like reviewing financial statements online, online bill pay. There's just so many features that come out each and every month that we're looking to roll out.
So let me ask another point, because I'm sure so many people at home, may worry, well, my whole medical record, is it safe? Is it secure? Can you share with our viewers a little bit about how secure the system is?
Yes, and that is a common worry when
Right.
patients are offered MyChart. They don't want their information online. So MyChart is not an open movement of patient information. It's a view into your already established medical record. And it's a secure view that you establish the connectivity, you create the password and codes to log in. It's not shared with anybody else, it is just local to you. The only other caveat to that is you can ask for proxy access to a child's medical record or a parent's medical record for those that you care for.
That's wonderful. I see this as such an important development, again, for eliminating silos and gaps in care. I wish I had this when I was practicing emergency medicine, because literally it breaks down the boundaries of where care is delivered. Your record is mobile. It comes with you anywhere. I think all the time of families that may travel, the snowbirds down in Florida, up here in New York. You bring your record with you. So you may be in a strange environment, but your health care should not be strange to the team that is going to be caring for you.
Yes, and I think that's an important point, because I think there's many times it's difficult to share a complex history with a new provider or a specialist.
Yes.
And this way, like you said, when you're traveling, the record goes with you. It's easily available for another provider to have a look at.
So that's really incredible. I think it's revolutionizing the way that we provide care. I think it improves quality and patient safety, and I can't thank you enough. So thank you, Debbie Kelly-Scott, for joining us. We'll be right back. Studies indicate that patients who are actively engaged in their overall care have better outcomes. With me now to discuss this further is Jason Tagliarino, Director of Population Health Systems at Catholic Health Services. Welcome, Jason.
Thank you for having me.
I'm thrilled to not only have you on the show, but to have you in this position because population health is our future, and I think you do an incredible job as directing what I will say is Pop Health IT and taking all of this incredible technology and helping take it live and integrate it for really improving the care of our patients and connecting providers. So let's talk a little bit about MyChart.
Okay.
How does MyChart assist you in these transformative efforts that you're leading?
Sure. So I think to start with, it's important to understand what the transformation is and how does MyChart fit into population health.
Right.
So in order to do that, we have to understand what population health is. So the goals of population health are, number one, primarily to improve the overall patient population and their health.
Right.
But also at the same time, to be able to deliver affordable health care.
That's right.
So how do we do that? We have to do that by moving from a reactionary healthcare environment to a more preventive care one.
Right.
So in order to do that and shift that transformation from a reactionary to a preventative, we need to really have our patients engaged in their health care. So patient health care is important to when you have patients that are engaged.
Right.
And studies have shown, I think as you mentioned before, that patients who are more actively engaged in their health care have better outcomes.
No question. And then you look at how do you engage providers, and you and I, we speak to this all the time because we work together on so many projects, but you know, your point about being reactionary and moving it into being more proactive, it really involves getting the right information at the right point. And so many times in healthcare prior to all of this, we would react to something that have happened. We didn't get that information ahead of time. I almost consider some of this like radar. It creates the map. We get a sense of what's going on.
Absolutely.
So how could like MyChart assist maybe some of our care managers or providers, you know, as we transition to this population health model that you've described?
Sure. So I think that in addition to the patient engagement component, it really does improve the access of care
Yes.
of which our providers are giving to our patients. So as an example, a care manager can, say for example, send a communication to a diabetic patient or an entire population of diabetic patients that are scheduled for perhaps a blood test or an eye exam. So we could really, in one full swoop, just send out a reminder to all of our patients that need to be reminded to, again, to be in sync with their preventative maintenance schedule.
Right. That's so important. You know, we used to have this saying in the emergency room, and I know that you're an emergency room nurse by initial clinical training, so you appreciate this. We used to say that, you know, to patients, I always knew you were coming, I just didn't know your name. And we would see all the failures in healthcare. And now with this information and with patient activation, as you mentioned in MyChart, people can understand what's going on with their healthcare sooner, before there's a decompensated state. Or to your point, we may be able to delay onset of some disease. You know, take someone who was pre-diabetic, to your point, catch them, get them into the right care teams, and delay. I'm not going to say we're going to prevent all disease, but if we could delay diabetes onset by 20 years in a patient, do you know what that means for them, their quality of life, or the cost of care, to your point? It's tremendous. Let me ask you another question, if I could. Are there other tools not previously mentioned that can assist us with patient engagement efforts? What are some of the other things that you're doing?
Sure. So there are definitely other tools. So we are implementing the ability for patients to be able to, from home, take the information from their home devices, such as blood pressure machines, glucose monitors, scales, and be able to feed that information to their smartphones directly into MyChart.
Wow, that's incredible.
So it kind of serves two benefits. So from the patient perspective, they're an active member of their care team. They're contributing data to the clinicians that is going to help the clinicians to make more informative decisions. So a clinician can receive that information into MyChart and look at potential early warning signs, changes in blood pressure, changes in weight, that may be an indication of something more severe and then be able to intervene much sooner than later.
Right,
So
catch it earlier.
Absolutely.
So really, like I always say, kind of like radar, you get a good sense of what's going on in the right time frame. Again, right care, right place, right person drives the right outcome.
Right, and another feature in MyChart is the longitudinal plan of care. And so Debbie had mentioned before, describing a lot of the features and functions, and that longitudinal plan of care is really a centralized view of all those various components. Now, one of the key components, going back to engagement, is the ability for a patient to see the goals that they're working with their care team to help define. So the patient's engaged by working with the care team to develop those goals and the interventions that are going to help them achieve those goals. And they can see how they're tracking and trending in MyChart as time progresses.
So that's wonderful. So it's kind of like can be also be used as a patient tracking tool to see how we're tracking on achieving our goals and working together as a team to improve their health.
Absolutely.
That's wonderful. I can't thank you enough, Jason, for being with us today to discuss this. We'll be right back after this.
He helped me learn to read.
It is the best feeling in the world. They impact me. I'm proud of the work that I'm doing.
There's been dramatic results in our kindergarten classroom this year from having a foster grandparent.
Hi, and welcome back. For recently hospitalized patients or patients who visit multiple doctors, MyChart's access to your healthcare history can empower you with knowledge about the services you have recently received and provide your doctors with the information of your care as well. With me now is Dr. Michael Moskowitz, a primary care physician on Long Island who is also on staff at Mercy Medical Center. Welcome, Dr. Moskowitz.
Thank you, Dr. O'Shaughnessy.
It's great to have you here. Can you share a little bit about how you as a physician use MyChart to connect with your patients?
Sure, Dr. O. I really find MyChart to be an outstanding experience that I'm able to share with my patients. The patients, they can send me a message through a secure server, and what I'm able to do is I get that information instantaneously. While I might not be able to answer right away, I usually can get to it within the hour and always the same day. It really does help foster a better relationship with myself and the patients.
So you're able to actually communicate pretty rapidly with patients and kind of get together, and they could be sending information and you could respond to it sometimes within a matter of hours?
Dr. O, in fact, it's usually faster than that. When you sign into a room and you have a screen, you know right away when you have a patient question. You click on it, you read it quickly, and then in between patients, I'm able to respond. I find it much faster than having to call a patient or call them at the beginning of the day or the end of the day. The patients, they love the fact that they get such quick communication.
So they do. So that was going to be my next question was, how have you seen this impact your patients, and have you gotten feedback from them on MyChart, and what are their thoughts?
Well, what they really do love is they love the ability to access the lab work and imaging right away. And they're able to share the information, if they need be, with their family members or other physicians. And they really feel more connected that way. Besides that, what I found is they love the ability to be able to schedule their own appointments. Yeah. And by scheduling their own appointments, they can take a more active role in being an active participant in their own lives.
Being engaged. So they're able to kind of e-schedule visits with you, which really helps with not just treating problems, but also for scheduling primary preventative services, which I know you're very passionate about. So your annual wellness visit, your flu vaccination, et cetera, et cetera.
Exactly right, Dr. O. And the great part is that MyChart reminds you, saying, you're due for your colonoscopy, you're due for your mammogram. We have the flu shots, and would you like to schedule an appointment? And it really helps them take a more active role in taking care of their own health.
I think it's wonderful. When clinicians and patients take advantage of MyChart, everyone can benefit. Let's head now to the office of Dr. Kenneth Fishberger, a CHS-affiliated internist practice, to learn about how MyChart can be convenient for all involved.
I had the fortune of being involved in EPIC, and in particular using MyChart for the last 3.5 years. MyChart is a very good way to access your chart if you're the patient and you're at home and you have any concerns. And it has been extremely useful for our practice to have this, as it has obviated a number of phone calls, had streamlined the practice, and has made it much easier for the patients to assuage any anxiety they have about their health care, as they can access their own chart, their own data, and their own lab tests. Right here we have the home page for MyChart. It has on the top, you might want to, and it's a suggestion list. You can view your test results, you can access an appointment book, you can review your health summary, and importantly, you can also send a message to your doctor's office if you like. The good news for the patients is it's easily utilized by using either your home computer or even your mobile device, and most patients are doing this.
MyChart's really great. You can access it from your laptop. I've even been able to download the app on my phone. So you feel like really 24/7 that you could really get access to your care, to check your lab results whenever you need to. You know, I've even been on vacation and been able to, you know, look up my results and, you know, get an email message that one of my prescriptions have been refilled. So it really helps my family feel like more access to our care at all times. It's been really great because I know when I was in the emergency one time and I had severe back pain, once I got out, it allowed me to access my blood tests and email my doctor and set up an appointment for a specialist. So it was really important for a patient and to feel like you're a part of your care with your doctor.
And if the patient is hospitalized, it is easy to access all of the data that is extremely important with regard to the patient's hospitalization. Reviewing of lab work, reviewing of imaging studies, and the general sense of how the patient did in the hospital is of utmost importance, especially when seeing the patient following the hospitalization. And it also gives the patient a sense of comfort knowing the doctor is extremely on top and involved. The interaction between patient, physician, and now electronics has become of utmost importance. We're very fortunate to have a portal such as this to allow the patient in, become involved with his or her care, interact with the physician, interact with the staff, and to be proactive with regard to their own health care.
So that was a great video, again, giving an example of how we can use technology like MyChart to provide added continuity of care between a hospitalization and, say, in the office with you, Dr. Moskowitz. And I know even patients as they travel now, whether they be on vacation or whatnot, they have instant access to the care as well as the care teams that are providing that care for them. Let me just ask you a question. What are some of the questions that you may get from patients in your practice? What are the things that they're querying you about, and how is MyChart helpful for then you giving the responses back?
Well, Dr. O, the main questions I get all the time are, Dr. Moskowitz, I started on this new medication. I have a little cough. Is it possible this is a side effect? So, and then I'm able to answer them back right away, and they know right away it's okay to continue taking it or I should stop. You know, in that vein, what patients do love also is they're able to now send me a question for a prescription renewals when they used to have to call the staff and put it through. So they could get it renewed right away, and even better, if I feel that they really need to come in for a quick tune-up, I could let them know in that conversation, I'll give you 30 days, but I would like to see you in the next 30 days, just so we could go over it. You still need to take the medication, or do we maybe need to tweak it a little bit? So
again, all the points you mentioned, Dr. Moskowitz, it's really about connecting you with the patient, engaging them in their care plan, and giving you what I'll just say is more easily accessible touch points with them, and eliminating a lot of layers of communication.
Exactly right. And what I also do love about MyChart is that there are now educational resources online where people can look up about their specific problems or issues they brought up with the doctor, and they're really able to get those answers right away, involved, at home, and able to really understand what they need to do to take better care of themselves.
So it sounds like this is really transforming your practice and helping provide improved outcomes. Would you agree?
Absolutely.
Well, that's wonderful. Thank you, Dr. Moskowitz, for joining us. We'll be right back. Some final thoughts on MyChart in our discussion today, really around what I'll say is e-health and using technology to your advantage. MyChart is a wonderful tool. It is incredibly powerful to help you as a consumer, to help you as a patient really achieve the best health outcomes. You know, when we talk about health outcomes, there are some major drivers that are leading the way for change, and that's great people, effective process, and innovative technology. And patient portals like MyChart do that for you. They link you and your provider, eliminating some of the layers and challenges with ineffective communication, and can really help you advance your healthcare. So please take advantage of it and sign up and put it on your device or laptop or desktop. And now for my health tip and solution of the day. No surprise, for this topic, it's really about leveraging technology to your advantage. And what I mean by that is there's just no way any provider or patient can keep up with all of the requirements in healthcare, whether it be around certain guidelines, recommendations, and despite best human efforts to align around these principles and guide patients to what they need preventatively, in the past, sometimes we would not effectively make all those recommendations. But as you heard Dr. Moskowitz and even Dr. Fishberger share, we could use technology now to build in and activate patients in their care and providers. So to remind you about when you need that mammography, based on your history, when you need that colonoscopy, all the things that we want to do and make sure we achieve to keep you healthy and out of the hospital. If you'd like to know more about MyChart or to make a gift in support of this or another program that is important to you, please visit chsli.org. From there, you can click through to one of the websites of each of our healthcare partners for more information on ways to give. We are always grateful for the community's support because your gift today helps shape the healthcare of tomorrow. Thank you for watching today. If you have any medically related questions you'd like for me to answer on future shows, please email us at healthconnect@chsli.org. Please include your name and a way to contact you in case we need to reach you. I'm Dr. Patrick O'Shaughnessy, and I hope to see you next time on CHS Presents Health Connect.